but we have no reason to doubt that the continued push to contain the spread of this virus across our countries and communities will soon yield the desired outcome. The Kingdom of Eswatini has not been spared from the effects of this global pandemic, and our intervention has been swift and targeted at preventing an uncontrollable surge in infections which could adversely impact our health system. A lot of ground has been covered since a national emergency was declared on the 17th of March 2020, since this pandemic started. This was followed by the implementation of a partial lockdown, which entered its 14th day today. We would like to thank their majesties for the continued counsel, wise counsel, and support and guidance as we continue to deal with this pandemic as a country. Let me reiterate that the virus does not move by itself, but is moved by people, hence the importance of adhering to the measures and regulations of the partial lockdown by principally staying at home. Over the past 2 weeks, Emaswati in their majority have heeded to the call to stay at home and adhered to the advice of the Ministry of Health and the World Health Organization to frequently wash hands with clean running water and soap and keep our home environments clean. This has been observed across many areas of the kingdom. We understand that such a partial lockdown is unprecedented and has affected our normal daily lives and activities, but is necessary. Government wishes to appreciate all those who have made this sacrifice to stay home and observe all the measures as prescribed by health professionals and the regulations of the partial lockdown. It is a given, though, that there are exceptions to the rule, as some citizens continue to ignore these COVID-19 regulations and measures. This is regrettable and unfortunate, as it places all of us in danger and negates our efforts to effectively contain the spread of the virus. Our security forces have risen up to the challenge and enforced the partial lockdown regulations, and we highly commend them for their service and urge the public to be responsible. May I once again warn against ignoring these response interventions which have been put in place to protect our country and citizens, and in extension contain the global spread of this pandemic. Getting back to our normal lives will be delayed if others refuse to see the bigger picture. Many of our health professionals have been exceptional in their course of their work at the height of this scourge. They have answered the call of duty with distinction despite the risks that come with tackling this highly contagious virus. Government will continue to prioritize the safety of our health workers at the front line of this disease. May I, on behalf of His Majesty's government, pass my gratitude to all the health workers who are continuing to execute their duties with dedication and commitment to save lives. Currently, Eswatini has 12 confirmed COVID-19 cases. While the numbers are steadily rising, it is gratifying to note that 7 of these patients have since tested negative and have been discharged. This speaks largely to the efficiency and dedication of our health sector, which, though works under challenging circumstances, continues to be competent. It is also a challenge for all of us to vigilantly fight to contain the spread of the virus to ensure it does not overwhelm our health system. I may report to the nation that through the advice of my doctor, I took a test for coronavirus early this week. My results are back and I've tested negative. It is important to note that we have been reliant on South African laboratories to test for COVID-19, and the turnaround time of results have been dragging due to high demand. As announced by the Minister for Health yesterday, government can report that our own laboratory facility has today started testing for COVID-19. This facility allows us to test up to 100 of suspected cases a day. Such a facility gives government the allowance to widen the testing scope to ensure that all suspected cases are quickly identified and proper interventions undertaken within a short space of time. We will continue to work on increasing the testing capacity in the country by ensuring that other laboratories are equipped to conduct and do the testing. The national disaster task teams are continuing to implement response measures across companies and non-governmental organizations who are working in close collaboration with government in this COVID-19 response. May I seize this opportunity to warn all those individuals and organizations within and out of the country who continue to peddle false information, using this pandemic to distract our focus and to push a political agenda aimed at destabilizing the country. The peace and stability of our country is not negotiable, and no one will be allowed to threaten it in any form or measure. Government will spare no effort in taking the necessary steps to protect the nation from uncanny characters with evil intentions. As we head into the long Easter weekend, may I take this opportunity to encourage all of us to continue being vigilant and responsible, especially by staying at home and ensuring that all around us comply with the health precautions and COVID-19 regulations. I urge all leaders of faith-based organizations and worshippers to ensure that even during this period when we celebrate the redemption of mankind, we adhere to the COVID-19 regulations, which requires everyone to be at home in order to prevent the spread of the virus. Our National Good Friday and Easter Sunday services will be broadcast live on television and radio with a link on government social media platforms to allow all eMaswati in and out of the country to access them. A formal announcement will be shared with the nation by Her Royal Highness Princess Lindiwe, Minister of Home Affairs. As we observe the Easter holidays, let me emphasize once more the importance of following the precautionary guidelines as provided by the Ministry of Health and World Health Organization. These include keeping our homes clean at all times and making sure that we don't touch surfaces. We wash our hands frequently with running water and soap. We stop shaking hands. We maintain a distance of 1 meter from each other, which we commonly refer to as social distancing. We avoid touching our faces. and we also take care of the vulnerable, especially senior citizens. And if you do experience flu-like symptoms, please visit your nearest health center or call the emergency medical service toll-free number 977. Government has also established an emergency toll-free line 112 for COVID-19 related emergency inquiries and for reporting incidences relating to the response and interventions of the virus. The partial lockdown will continue as announced for the duration of 20 days. Any review will be communicated to the public after the relevant consultations have been sought by government. There has not been a time such as this in our recent history when we all as individuals and together as a nation have to act urgently to ensure protection of our loved ones and indeed all our citizens. May I, on behalf of His Majesty's government, wish all Eswatini happy Easter holidays. Let us stay at home, stay safe, and stay alive, and let's worship God during this time and ask for His intervention so that the Kingdom of Eswatini, Africa, and the rest of the world is protected from this pandemic. Thank you. Sinvusele bekunene umhlaba wonke ulwa nananga umkhuhlane lesubuthe ngathi COVID-19 coronavirus lo se usitha lesikhulu sawonke umhlaba bekunene lala khona emave onke kufaka lona live la kaNgwane asukumile kulwa nawo lomkhuhlane sekuna 1.5 million webantu lese batholekele banaso lesifo umhlaba wonke lese bashonile bangu 80,000 kungako ke vele lomkhuhlane ubonakala ukuthi uda ngemandla udinga vele ukuthi sikhwice emhlabeni wonke sikhwice nathi even laseSwatini ukuthi silwe nawo lomkhuhlane sithi ke bekunene live la kaNgwane silivelelisukumile njengoba sibikile emavikini lengcile solo siyagqizelela ukuthi vele kumele ukuthi sende konke lokusemandleni ukuthi sivikele sive ukuthi singangenwa ngulomkhuhlane lokuningi ke sekwentiwe kuleli bandla le national emergency kune task force lelidwa nguye umhlonishwa DPM lala khona kunemabandla lehlukene labuke tingoni letehlukene ukuthi silwa njani naso lomkhuhlane lesigcizelelako bekunene ngiko ukuthi emaswati akahlale emakhaya kube ngilabo labenda umsebenzi noma ke labasebenzela tinkapane letenta umsebenzi lodzingakele sibita ngokuthi ma essential services ukuthi kube ngilabo labaphumela ngaphandle baye kuleyo misebenzi sine sonke sibe sihlete emakhaya ngoba njengoba sisho nje ukuthi lo mkhuhlane lona leligciwane alide tinyawo alihambi kodwa abantu bahamba ngithi ke sibantu lesihambisako lo mkhuhlane kulamaviki ke lamabili lengcile bekunene sibonile ukuthi emaswati lamaningi avele alalele ahleti khona emakhaya alalele ticwayiso lesitithola kulo litiko letempilo naye emhlabhlangene iWorld Health Organization sithi ke asikubonge lokhu bekunene sikudumise ngoba uma senda njalo siyadivikela thina siphinde sivikela nalabanye lamanye emaswati sithi ke le partial lockdown le menyetelwe ngihulumende athunywa ngiyo imbube yemhlaba ukuthi sihlale emakhaya sivikeleke sihlale siphephile singawuhambisi lo mkhuhlane kalula vele isaqhubeka bekunene lokunye ke lesithi asikukhude ngulaba labangalaleli labasaqhubeka bephula letimiso lesetibekiwe ukuthi asihlale emakhaya kuthi sandla semthetho sitawuvele siphakame bekunene labo bemthetho sebavele bathunyiwe ukuthi abawendi lo msebenzi wekuthi sive silandzele lemigomo lebekiwe bekunene sithi nje asisendlulisele so sicwayiso bekunene timpilo tethu setivele titsinzekile ndlela tside ngalomkhuhlane lona kufuna sale sikwemukela ukuthi vele lo shintsho selitaba khona angeke kube into lemnanzi ukuthi sesihlete emakhaya kanti bese tayile kuvuka siye emisebentini kulabo labangendi imisebenzi lesithi essential noma ke lefanele sithi nje asigcizelele lokho bekunene ngiphinze ke egameni lahulumende wembube sendlulise kubonga kakhulu kulaba labasebenta etibhedlela nayo yonke nje imitholampilo labasebentako ngekukutikhandla ngoba lo msebenzi ulukhuni lo bekunene ngoba nabo timpilo tabo tisengotini ngibona nje labacishe singathi basengotini lesenkulu lesetulu ukuthi balithole